Kayla.
I'm Cassidy.
I'm Alex.
And this is our rehab project.
Meet Bobby. Bobby is a 25-year-old male who is also a mechanic on the side. He works 60-hour weeks to support his 2 children, so he does not want to be out of work for long. He recently sustained an injury from a fouche, was the MOI for the injury, and about a week ago he had surgery for a TFCC lesion, which is a triangular fibrocartilage complex lesion. He loves to play basketball on the side with his buddies on the weekends when he has some free time. So upon evaluation after his surgery post-operatively, he presented to our clinic with swelling, pain on the ulnar side of his wrist, and decreased function with pronation, supination, flexion extension, and radial and ulnar deviation as well.
So the TFCC complex sits between the lunate and the triquetrum and consists of the ulnar triquetral ligament, the dorsal radial ulnar ligament, the volar ligament, the ulnar lunate ligament, and the triangular disc. And it helps with stability and helps absorb forces. Typical patient presentation, mechanism of injury is fouche, which is falling out on your outstretched hand. Patients usually complain of ulnar-sided pain that doesn't get relief when at rest. Pain occurs with gripping, forearm pronation, and wrist deviation. Patients most likely have instability when trying to push off things such as like a chair, and usually patients hear an ulnar click.
There's a set of classifications that come with these TFCC lesions. There are 2 types. Type 1 is traumatic and type 2 is degenerative. Our patient suffered from a class 1 B, which actually means it's traumatic, and it's an ulnar avulsion at the triangular fibrocartilage of the complex. We're seeing our patient post-operatively. He's already had his surgery. They fixed the piece of ulna that was detached back to the distal end of the ulna with a plate and screw. We're seeing him 1 week after his operation, and he has been immobilized the whole time. Major concerns include any residual pain, loss of function, the possibility of infection from that wound, and any deconditioning that he may have experienced over that course of the week. Because that wound is closed, we're going to go ahead and start doing cold therapies, and we're going to start working with some therapy putty. Patient can squeeze the therapy dough, flexing the fingers, increasing venous return, and decreasing swelling of the digits.
For phase 2 of Bobby's rehab, we are going to really work on improving his active range of motion with these exercises. We're also going to work on early strength training at his wrist and some early proprioceptive skills as well. The exercises we're going to do in phase 2 include air riding, wrist pumps, towel wipes, isometric flexion and extension exercises, as well as TheraBand DV. Now we're going to demonstrate for you the air riding exercises and the TheraBand deviations. Patient will write her ABCs, or his, in the air with a popsicle stick to work on multiplanar mobility. For wrist strengthening, the patient will grab a TheraBand, wrap it around the hand, and then perform pronation and supination against the resistance, and also radial and ulnar deviation as well. And deviations. So these exercises all really work on his active range of motion, early strength training, and some early proprioception as well. So now moving Bobby into phase 3, before we begin, we really want to make sure that his ulna has fully recovered from the surgery. It's fully healed before we start any of the next stages of exercise, because we're going to work on moving further into strengthening exercises and proprioception exercises as well. So a few exercises that we included for his rehab were wall push-ups, juggling, chest passes with a basketball, and opening a jar. So we're gonna demonstrate for you chest passes and opening a jar. Patient will open and close jar to work on grip strength and functional mobility.
Okay, so now we're in phase 4 of the healing process and of Bobby's rehab, which is the remodeling phase. We'll be incorporating more plyometric and functional specific exercises, which include wrenching a bolt, a full push-up with a clap, a chest pass with a medicine ball, dribbling, and kettlebell rotations. The exercises that we're going to be demonstrating for you today are the chest pass with the medicine ball and the dribbling.
Based on an article by Soar, the discrepancies between grip strength, wrist flexion, and ulnar deviation were all pretty small. So basically, it could be treated either way as long as it was a union fracture or a non-union fracture smaller than 2 millimeters. Another study found if the distal radial ulnar joint was unstable, there was about a 30% decrease in the torsion forces created during pronation and supination. Because our patient had an ulnar avulsion TFCC lesion, we only have to worry about the bone healing timeline instead of the ligamentous healing that normally occurs with most TFCC lesions. Patient can... I can't ever be an actress.
It wasn't that bad. Okay. Typical
Stop. So we don't have to worry about... No, we do have to worry about stuff.
On strength, like keep the strength going, like pump up the strength.
Pump up the strength, pump it up.
He'll be doing more.
A little stretch.
And this is our rehab project.